Hey guys, I'm Siobhan, a third-year medical resident. I really want to thank all of you who've been sending encouraging messages during this difficult time. Having a supportive community really means so much. The weird thing is that life just goes on during a pandemic, and people are getting sick from things other than COVID-19, even though that's all we hear about. So right now, I'm currently finishing up my rotation in obstetric medicine. So basically looking after pregnant patients who have other medical complications. And so you're gonna come to clinic with me today, see what that's like. The hospital definitely looks different. And then next week, I'm starting a month of shifts in the emergency department. So that's definitely gonna be a change of pace. All right, let's get going. Entering the hospital feels different. The parking lot's usually packed and it's mostly empty. You're asked questions about symptoms before entering, and patients aren't allowed to bring in partners or visitors. So it's definitely a more isolating experience. So from a coronavirus standpoint, we're seeing the numbers increase as we expect, but we're still expecting the worst to come. So right now I really feel like we're still all in preparation mode, and all around you just sort of feel this tension, this concern with everyone. You see someone, everyone steps away. Everyone's doing their best, but you definitely feel a little bit of that anxiety, especially in the hospital. Grabbing my patient charts for the day and heading to clinic. Oh, looks like a crime scene here. All right, so now I am basically approaching things like everything has COVID on it. Every surface could have COVID, so we need to just clean and wipe everything down. So since this COVID pandemic, we're trying to have patients come into the hospital less and less. So we're gonna be doing these patient visits over the phone, like virtually. And it comes with its challenges, so we'll see today how that goes. Okay, so this first patient is being referred for gestational hypertension, so high blood pressure during the pregnancy. And this can have a lot of different effects. It's pretty common, but it can affect the blood flow that gets to the baby, because it affects the placenta. Babies can be on the smaller side, they can be delivered early if we don't manage it. And for moms, if this gets worse, it can lead to actually organ damage in the body. So it's something we take really seriously, and blood pressures that we wouldn't worry about too much in most people, we might freak out about in a pregnant patient. So I'm really hoping that this patient has a blood pressure cuff at home or knows their blood pressure values. Otherwise, it's hard to do this over the phone. And does that make the headache better or worse? Okay, let me just look that up here. And do you have a blood pressure cuff at home? Fantastic. Okay, can you tell me some of the values that you've been seeing recently? Yeah, exactly. Just going back, let's say a week, the different values that you've been seeing. Okay, phew. I'm really glad that she had a blood pressure cuff. If she didn't, it would have made it more difficult, and we would have had to get her a blood pressure cuff or have her go to the pharmacy and check it a couple of times, because you don't want to start a blood pressure medication if you don't actually know consistently what the blood pressure is. So in this case, we can safely start her on a medication called labetalol, and then we'll follow up with her in a couple of weeks to see how her blood pressure is doing, and she'll continue to monitor it. Ring, 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 ring. Nope. Okay. No answer. I'm not sure. I guess, you know what? I'm just going to check and make sure that she's not actually in the hospital or something more serious that I should know about. Nope. Not seeing anything on the computer there. Don't see her admitted anywhere, so that's a good sign. At least she's not answering because she's not feeling well. Let's just try one more time. Nope. Okay. All right, we'll try again a little bit later. But I guess that gives us a little bit of time, can update you about some of the things that are going on in my life, I guess. Okay, so I guess a couple of months ago I told you guys that I was taking a break from making videos because I was studying for the biggest exam of my career and of my life, the Internal Medicine Royal College exam. It's like Mount Everest. Studied for so long, so many facts just crammed into my brain, and just less than 2 weeks before the exam, it got cancelled, postponed until probably September because of the coronavirus pandemic. Just devastating for us, and affected a lot of residents, you know, where they're gonna be moving, if they can work, and a lot of things. So it was challenging. In the bigger picture, when we look at what's going on in the world, fair enough, it's just an exam, so we're all recovering, but we sort of pivoted from like the stress of studying for this exam to pivoting towards the stress of this pandemic. And personally, this is probably the first time that I've ever been confronted with mortality and possibly catching something and dying in your job. I mean, to be honest, I don't think I can kind of go there emotionally right now, and I've just sort of kept that compartmentalized off for myself. Because right now in clinic, I don't want to get emotional. I need to sort of stay focused and be able to see patients. But if you guys are interested in me talking about this a bit more and how I'm feeling about it, let me know, because I'm happy to do that. It might be a little bit morbid, a little bit sadder than most of my videos, but just let me know, because it's something that might even be good for me as well. Okay, next patient. Man, I feel like I'm not even moving from this chair. At least normally when in the hospital or during clinics, I can kind of like walk around, get papers, go get patients, but I just feel so sedentary. Anyway, this next patient we're seeing for gestational diabetes, so high blood sugars during pregnancy. So hopefully she answers. Well, thank you so much for agreeing to have this call. Definitely appreciate that. That makes a big difference. Well, hopefully it's convenient for you as well, because you know, it can be a challenge, especially coming into the hospital, and we're trying to avoid patients with exposure to COVID at this point. So I'm glad you're doing better. Good to hear. All right, we'll talk to you later. Bye. Okay, so this is a bit of a challenge. This patient lives a little bit further out, harder for her to drive places. And we're kind of worried that there's some kidney damage, so I really wanted her to get some blood work from the last appointment, but unfortunately she hasn't been able to do any of it because the labs near her are all closed for the pandemic. So I'm asking her to call around, and I'll call around a little bit as well to try to find somewhere near her that she can do it. Otherwise, really hard to know how to treat her if we don't know what the issue is. I'm gonna talk to my staff about this and see if she has any other ideas. A big challenge. Oh, also, have you guys noticed how many times you want to touch your face? It is so hard. I keep catching myself just scratching, and when I tell myself I can't, I just really want to scratch myself or rub my eye. It's really hard. All right, so I just saw the last patient. Now I'm gonna go and find my attending physician, chat with her about the patients that I've seen, what the plans are, if there's anything she wants to add, and then it's the fun sort of administrative paperwork stuff. And because I can't hand patients prescriptions, I'm gonna be calling pharmacies and leaving prescriptions over the phone, faxing in lab recs that they can fill at their labs near them. So a lot of little administrative stuff that is not as much fun for you guys to watch. So I'll leave it here. And I just want to say that until I see you in the next video, stay safe, keep washing your hands, keep going with the social distancing. I know it's already been a long time and it's wearing on people, so just know that we really appreciate all the effort you guys are putting in to keeping yourself safe, because it makes a huge difference for us in the hospital side of things. So anyway, stay safe and bye for now.